All right, everybody, good morning. Welcome. In accordance with the Open Meetings Act, Texas Government Code, Chapter 551, and the public notice published by the Texas Secretary of State, this in-person meeting of the Commission on State Emergency Communications is hereby called to order on September 25th, 2024 at 10 a.m. Our first order of business is to certify that we have a quorum. All commissioners are present with the exception of Clint Sawyer and Chip Van Steenberg. At this time, I would entertain a motion to excuse those commissioners.
Motion to excuse?
All right, there's
Second.
a there's a motion by Richard Muscat and a second by Commissioner Mitchell. All those in favor say aye.
Aye.
Any opposed say no. The ayes have it. Those commissioners are excused. And at this time, we'll move on to future meeting dates with Andrew.
Good morning. So we have the next commission meeting scheduled for November 20th. I believe Karen has gotten with everybody to verify that date on everyone's calendars. And then we're still firming up dates for the January 2025 meeting. So again, Karen will be following up with everyone to see what availabilities that we have.
Okay, so next meeting, November 20th. All right. At this time, we'll open up for public comment on agenda items. If anyone wishes to comment on a particular agenda item, you can do so at this time by stating your name, and you'll be recognized to speak. Or if you'd prefer, you can save your comments to that specific agenda item. At this time, is there any public comment? There is not, and so at this time, we will move on to our agenda. And the first order is we're going to have a short recognition this morning of Commissioner Sue Brannon. In the 20-some-odd years that I've been here, we have only actually, this is the third commissioner pass away. The other two, Judge Wright from Caldwell County in 2010, after his term was over. I believe John DeNoyles, who was our presiding officer for a time there, passed away last year. But this is the first time in my service on the commission that we've actually had a commissioner pass away during their term of service. So we wanted to take a moment to recognize Sue this morning. For some of you who are a little bit newer here, you haven't seen Sue. She served starting in 2009, so it's been 15 years, so she's going to get a plaque. Whether she's here with us today in body or spirit, she's going to get a plaque for 15 years of service. But she served on this commission for some time. She was great during COVID, but during that time, her health kind of started to decline. It was very difficult for her to travel, and so since we've started returning back to in-person meetings, she was unable to participate. That being said, as a frequent visitor, she always read her packet. She knew what was going on, so we appreciate that very much. And I know the Lieutenant Governor's office will have a big issue to fill those shoes. For me, I've known Sue very well, but I'm not really sad, and the reason why is having known Sue, in 1980, she lost a son in a car accident. And that was a big issue for her. It was very, very tough. Sue, 363 days out of the year was sunshine and sparkles, but on the anniversary of her son's death and on his birthday were really, really dark days. She did, throughout the community, though, help a lot of other people who had lost kids. I think there's only certain people that have been in that situation that can understand that can really help in those situations, but she did. And I always remember one of the things she would talk about is going to the cemetery on those days and saying, it's hell to go to a cemetery when you've got a husband and a son there, but it's okay because one day I know I'll see them in heaven. And so that's why I say I'm not really sad. I know where Sue is at. If there's anybody that made it, it's Sue Brannon. And so she's seeing them again. So we just wanted to recognize her this morning. I'll open it up if anybody else has any comments, but we appreciate her service.
Sad that she's gone. Enjoyed working with her, and I just pray for her family.
Absolutely. Well, we do have a plaque for up here, and we'll be providing that to her family in recognition of her 15 years of service here on the commission. All right. Well, that wraps that one up, and we'll move on to the next, which is our agency operations or executive director's report. I'm sorry.
Thank you. So first up, we have some staff service awards, as well as also a recognition for Dr. Jeannie Shawwart from the Panhandle Poison Center for her years of service. But we'll first start with our program director, Heather Barnes, who celebrated 10 years with the agency. I would like to say and actually extend a personal thank you for everybody in the room knows that I started here in January, having very little to no knowledge of 911 or poison services for that matter. Heather has been a key individual on both CSEC's leadership team, but well as just a personal confidant to me in understanding and learning the programs, providing me advice and counsel, and just making sure that I stay out of trouble. So I appreciate you and everything you do around here. And this is for 10 years with CSEC and the agency. So we'll do a photo up front here, unless anybody else would like to say something as well.
Yeah, I was like, yeah,
You're going to have to come on up here.
yeah.
Oh yeah, we can do it down there. Should we do it down there?
I think we should do it down there.
Yeah.
And if it's okay, let's get all the commission to do this. Everybody's had the chance to work with Heather. This ought to be a group photo in 10 years.
Yeah.
Ain't nothing, because you're going to do another 10, Heather.
Another two. Yeah.
All right, Andrew, you're still up.
All right. So the second item there is a recognition of Dr. Jeannie Shawwart from the Texas Panhandle Poison Center. She has been with the poison program for 21 years. She recently has decided to move on to greener pastures. And we're sad to see her go, but we're excited for her new opportunity. So we just did a recognition for her as well. But if anybody else in the room would like to say a few words, we're more than happy to take public comment.
Good morning, Commissioners. My name is David Baker with the Central Texas Poison Center. This microphone's really loud. Wow. Okay. There was so much that I had to actually write it out because there's a lot to say. Today we recognize some of the accomplishments of Dr. Jeannie Shawhart and wished her well on her future endeavors. Jeannie is truly a remarkable managing director who has been with the Texas Panhandle Poison Center for close to 25 years. Over the past 2.5 decades, she has not only led the TPPC with grace and grit, but she has inspired all of us with her dedication, wisdom, and unwavering commitment to excellence. And she's diligent about QI, and I tell you. Jeannie started working the Texas Panhandle Poison Center in July of 2001 as a pharmacist resident taking poison calls one day each week during her drug information and health policy residency. She was later appointed as managing director in the fall of 2003. Under her direction and together with the Poison Center staff, TPPC was certified in 2004 and then accredited 4 times, so ever since she's been accredited. She has served as both the co-chair and chair of the Texas Poison Control Coordinating Committee and has served on numerous committees throughout the 25 years. She has also served on statewide committees outside of the TPCN, including the Pharmaceutical Disposal Advisory Group to the Texas Commission on Environmental Quality. That's a mouthful. And she chaired the Texas Standing Tall Prescription Take-Back Work Group. Perhaps her greatest legacy with TPCN has been the inception, development, and implementation of the medication clean-out program that is now in its 16th year of operation and has resulted in the collection of more than 80,000 pounds of unused medication for appropriate disposal. By removing unused medication from the home, the program has undoubtedly prevented numerous poisonings and potential drug overdose deaths. The program has also been recognized by the U.S. Drug Enforcement Administration as an outstanding contribution to the federal service. The medication cleanout was also a key component of Texas Tech University Health Science Center School of Pharmacy's application for the National Weaver Award. The Texas Panhandle Poison Center staff had this to say about their boss and their friend. Through countless challenges and successes, Jeannie has been a guiding force, leads with integrity, vision, and compassion. We are deeply grateful for her leadership and the personal impact she made on each of us. While it is difficult to say goodbye, we wish Jeannie all the best and look forward to hearing about this next chapter. She will always be a cherished part of the Poison Center family, and I'm pretty sure she'll keep talking to us. Thank you all.
Thank you, Dr. Baker. And Jeannie, thank you again for your service. We appreciate you. All right, Andrew, we're going to get your status update on the legislative appropriation requests for fiscal years 2026 and 2027. And just as a note, members, you all received a link from him to his testimony before LBB staff, and Andrew did an excellent job. I thought you really encapsulated this program in the few minutes that you're allotted in that format, but you did an excellent job, so thank you.
I appreciate that. They only give us 10 minutes, and summarizing all the work that we do in 10 minutes is quite the challenge sometimes. So as the presiding officer stated, so we submitted our legislative appropriation request August 19th, following the submission of the LAR that essentially kind of kicks off the beginning stages of the 89th legislative session related to the actual budget process itself. So following the submission of the LAR, the LBB holds a joint budget hearing, which includes members from staff members from the House Appropriations Committee, Senate Finance Committee, the Governor's Office, and then also LBB staff. And we essentially the agency presents its LAR and exceptional items to those individuals and allows those folks to ask questions to us. Essentially the hearings allow state agencies to present the LAR, and the information presented in these hearings are pretty integral. A significant portion of the state budget really gets allocated out prior to session begins. The budget process is happening as we speak. You know, the session is a very short period of time, and when all of these budget hearings conclude, those individuals come together and create decision documents and recommendations to their appropriate chambers that really start the draft budget bills. So SB1 and HB1 are the draft budget bills that get filed in both chambers and is really the starting point of where the budget is. And you'll see those draft budgets essentially have probably 90 to 95% of our budget pre-allocated out before session even begins. So I really can't stress enough how important those hearings are in allowing us to advocate to the respective chambers, the LBB and the governor's office, what the commission's priorities are, and make sure that our priorities match the recommendations and include them in those base budgets. So in all my conversations with those individuals, they were very positive and understanding. They understand the ramifications of the Broadband Infrastructure Fund bill that gave us a bunch of money and how we have to ask for that as an exceptional item. They understand the needs for the Texas Poison Control Network that we're also asking for. So I'm feeling good going into session. We're at the very beginning stages. There's a lot that happened between now and the end of May, but we have officially begun our process. So happy to answer any questions if anyone has any.
All right, well, we'll move on to our next item, which is our internal audit and our fiscal year 2024 annual report. Garza and Gonzalez is here to make that presentation. And I know we've had several meetings. Vaughn, you've been on that audit committee and done a great job there, so we'll look forward to this report this morning. Thank you.
We're a little confused on where we sit or stand, but
Anywhere you want to. How about that?
Thank you, Commissioners. I'm Kim Lopez Gonzalez, representing Garza Gonzalez and Associates, the internal auditors for this agency. And here with me today is Chika Cherry, who is very key in performing these audits for the agency. We are happy to be here this morning to present to you the annual internal audit report for fiscal year 2024. As the presiding officer has mentioned, we have performed several functions for the agency throughout fiscal year 2024, which have been brought forward to the Internal Audit Committee. Mr. Washington, I understand you are one of the three members, and the other two have left you here to address any comments, but thank you for that. We are glad to see several changes that have been made that have oversight over our functions. We are working to meet those different requirements that are being asked of us as far as one of the items that we will be changing, not for fiscal year 25, but after that, just because we didn't have enough time to change that, but as far as timing for a risk assessment to follow for fiscal year 26. Fiscal year 25, we will still come to you in January for the audit plan, but we understand that there will be some changes to those dates following fiscal year 25, so you can have that sooner than a January meeting. So we understand there's changes for the oversight of the internal audit program, and we look forward to working together with management to make sure that those processes are put in place as requested. But what you have before you in your board packet is in pages 5 through 12 is the internal audit annual report for fiscal year 2024, which we are here to report to you. This report pretty much just summarizes all the activities that were performed during fiscal year 24, and it does meet the Texas State Internal Auditing Act. So it does meet all the requirements as set forth by that act, and also the state auditor's guidelines. The state auditor's office is the one who ensures that the internal auditors do meet those requirements of the act. Page 7 of the pack of your report for the internal audit annual report does provide you with our report to you, which indicates that as part of the approved internal audit plan, which was approved by the Commission on March 27, 2024, as part of that approved internal audit plan, we were authorized to perform the risk assessment, prepare the internal audit plan. That report was dated February 27, 2024. To perform a human resources and payroll audit. That report was dated May 24, 2024. To perform the 911 program administration area audit. That report was dated August 12, 2024. And then also to perform follow-up of prior year internal audit comments and recommendation. That report dated August 1st, 2024. We understand that the Internal Audit Committee met on September 9th, 2024 to review all these reports that were presented to management. And they have reviewed it with management and have approved those reports. And upon this commission, after this commission meeting, what will happen is these reports will be submitted to the state auditor's office and other entities by November 1st, which is the required deadline for all reports to be submitted. On page, just want to kind of highlight some of the information in here. Not everything that, I don't want to cover everything. Most of the information in here is included to meet those state auditor's office guidelines. But page 11 just does give you the titles of the reports and the objective of each of those audit reports. And finally, page 12, if we were not to perform a risk assessment for fiscal year 25 and just use the fiscal year 2024 risk assessment, the areas we would be proposing for audit would be the 911 performance compliance monitoring audit and the accounting and financial reporting audit. We will always perform follow-up procedures and, of course, always prepare an internal audit annual report. But we do plan to prepare a risk assessment for fiscal year 25, so those areas may or may not change based on that risk assessment, and we will bring that audit plan before this body at the January 2025 meeting. And with that, I'd like to answer any questions that you may have.
Any questions? It doesn't look like there are any questions, so it was pretty thorough. That being said, I know, again, that the audit committee had a chance to look at all of these, and so at this time, if there are no questions, I would entertain a motion
I'll
to
present a
accept these
motion.
audits.
Real quickly, just want to say,
Turn your mic on.
it's on.
Oh,
Flames on. Okay, good. I got that out of the way. No, we met in early September, and the executive director was there. As always, great report, great quality work, and I know most of the recommendations are already underway, so thank you. Motion presented to accept the report.
there's a motion from Vaughn Washington. Is there a second?
Gross seconds.
Kathy Squirrell seconds that motion. Is there any further discussion? There being none, all those in favor say aye.
Aye.
Any opposed say no. The ayes have it. Thank you, ma'am.
Thank
We
you.
appreciate
And
you.
one last comment
Okay.
that I failed to make. Wanted to make sure that you knew that the audits were performed efficiently. All information requested was provided to us in a timely fashion. And I would like to recognize Monica Watt because she is our audit contact. She keeps all of us in line and make sure that we are receiving all information. We are not restricted in any form or fashion, and we are the ones who set the scope and just felt like that is something that you should know. Thank you.
Gotcha. Thank you. Monica, good job back there. All right. Then we will move on now to our appropriation year 2024 financial update with Lorraine.
Hi. Good morning, Commissioners. My name is Lorraine Meek. I am your Chief Financial Officer. Please turn to page 46 of the Commission Meeting Notebook, and we will go over 2024 financial update as of August 31st. This is for general revenue and general revenue dedicated only, and this is informational. No actions are needed. In the top section is the expenditures. Per the General Appropriations Act, we were appropriated $64 million. The amount expended and accrued includes all of our allocations to the for the strategic plans for the regional planning commissions and regional poison centers, and administrative contracts and payables. The available balance is 4.6% of what the appropriation is, and of that available balance, 80% of it is related to the 911 network operations and equipment replacement. In the revenue section, I'm going to first go in the total revenue column, and for prepaid wireless, we have a little over $1.7 million, almost $1.8 million. And in regular wireless, we have 22.1 for a total of almost $24 million for wireless. In addition to that, we have almost $3.9 million in landline services, bringing total service fee revenue to $27.8 million for 2024. In addition to that, equalization surcharge came in at $22.8 million, bringing the total general revenue dedicated to $50.6 million for the year. Now, if we compare that to the general revenue dedicated portion of our appropriation, as noted at the top, we are underfunded by $3 million of general revenue dedicated. So with that, we would need to use fund balance in funding those appropriations. Now, if we go across the total receipts to date, which is the bottom third of the revenue section, the comptroller's biannual revenue estimate is $29.9 million. We had $50.6 million, so we generated $700,000 more than what was estimated. So we are pretty good on that biannual revenue estimates. And side note, we've gotten that request as well for estimating the revenues for the 26-27. So those will be getting updated. Should be in January. Now, for our fund balance, if you take a gander over the periods of times that we meet, you'll see this estimated revenue or estimated fund balance for GRD to have fluctuated as we would expect. And now we look pretty gosh darn healthy. Surcharge has steadily remained in the $60 million range. And we built the 24-25 to be with our revenues that we were expecting, same as 22 and 23. For both surcharge and service fee, because our 22-23 biennium, we built it based on the revenue, and that's what we allocated based on the revenue. We ended up lapsing back to the fund balance a good chunk of money. So for 5007, within 2024, we lapsed back $5.7 million, which helps our fund balance in surcharge. And then for 5050, it was almost $20 million that got lapsed back into the program, where a lot of that was the capital project that came back and the appropriation for that was in excess of our revenues in prior years. So that is what helped build our fund balance back to where it is. This is informational only. No actions are needed, but I'm here for any questions.
Can you talk about the Prop 8 line that got added to this year's report?
I am so glad you brought that up. There's a lovely asterisk down there. It's a single asterisk. It's labeled Estimated NG 911 Service Fee Proposition 8. And it indicates that this is a transfer that is going to move the funds that was provided by the legislature and put into Fund 0195 from the broadband infrastructure. Majority of those funds were have already been distributed to the emergency communication districts and the municipal emergency communication districts throughout the state of Texas. And then the portion that is attributed to the Regional Planning Commission that are still within the state program will transfer out of that fund and into 50/50. And we are projecting that to occur within fiscal year 2027. So there is that line for $22.267 million, just to show ongoing that as of right now, the fund balance really reflects, minus that is $41 million. but we are expecting this additional $22 million to get deposited into Fund 5050, which again helps build up that fund balance.
Super. Well, I'm glad y'all added it to the report because I think we know that money is out there and technically it is not in 50/50 today, but it's in a separate account, but that earns interest. Good job. But I think it's good for us to see that and to know it's out there because it gives a better financial picture. So thank y'all for adding that in. Any questions for Lorraine?
I think I just heard one thing, and there was a transfer back into fund balance from capital projects. It didn't happen. I don't want to have in full discussion, but I just want to make sure that things got done that were supposed to. I'm curious as to why that money came back, and that may be for another report another day, unless you already know.
I cannot speak fully onto it at present, but it is related to the Next Generation 911 and the ESINet project that termed 8/31/23. And with that, this was the remaining balance that was left over from the project. And we did satisfy that project.
Yeah, it mostly costs came in lower than what we had what the agency had originally planned for. So the money just came back to the.
And I will say a lot of that appropriation had been rolling from prior bienniums. I can't say how many, but at least 2. And so it's been building and rolling forward.
Any other questions for Lorraine? Great question, Kathy. All right, if not, then we will move on to our Next Generation 911 Fund Grant Program Update with Noah. Or I'm sorry, our Proposition 8 Broadband Infrastructure Fund Update. Sorry about that, Noah. There you go.
Good morning, Commissioners. I am Noah Gilliam. I'm your Director of Contracting and Purchasing. I'm here first to give you an update of our Proposition 8 funding and where we currently sit as far as certifications and reports. What I can tell you is on page 48, you'll see a certification and reporting table that shows the total number of 911 entities including the certifications that have been received and accepted. In the previous meeting, we had an additional column for the reports. There was one report that was due at that point in time. So what I can tell you is that all the reports have been received and accepted for those entities who have provided at least their certification to us. We still have several entities where we have not received a certification. We have one 772 ECD for Texas Eastern that's still outstanding, as well as 5 municipal districts. City of Ennis. The City of Ennis is scheduled to have a city council meeting on the 15th of October to review that, as well as their contract for SB 8 funding. Glen Heights, Kilgore, Lancaster, and Sunnyvale are the remainder of those districts that we still need certifications for. Since the last report, we have received one additional certification, and that was from the City of Mesquite. So that puts us now at $132.6 million out of the 155 has been distributed. That's about 85% of the total allocation of 155.2. And with that, I stand for questions.
Any questions for Noah?
Are you in contact with the cities that have not reported yet? And do we need to reach out to them, particularly since I represent municipalities? Can I help in any way?
Sure. We have had a lot of assistance from MECTA. They have reached out on our behalf. I am prepared to send another reminder out on Monday of next week. We have had at least some communication. There has not been as much non-responsiveness. It's just people are trying to get it on their schedules for council and board meetings and those sort of things.
Okay, thank you. Let me know if I can help.
Sure will. Thank you.
Any other questions? If not, we'll move on to your Next Generation 911 Fund Grant Program Update.
Thank you, Chairman. Now on page 51, I want to start off by reflecting that the City of Ennis, again, they are scheduled to go before their City of Council for their SB8 contract on October the 15th. So that will be the last remaining grant contract that we will need for the last remaining entity into the program. That will then be, everything will be everything is already allocated, but then they'll be able to start their project. I do want to reflect, there has been some questions in prior commission meetings about the entities that are still showing 0%. So I do want to touch on that a bit. I have instructed my federal grant contract managers to begin the process of reaching out to those entities to get a clear picture of what exactly may be happening on the local levels for this particular issue. I can speak to a few if there are questions about specific ones, but I would rather wait for those questions to talk and do so. But I will give you a short update as far as the funding that we have distributed since the last meeting. We've distributed $9.6 million, which is about 7% of the total allocation of $150 million. That puts us right around 74.7 million, or nearly 50% expended of the program. So we are slowly catching up to that time elapsed of 56% so far. And then the next section we have here is for our grant compliance. We have been undergoing compliance monitoring of both RPCs and districts, both the 772 and municipal districts. I'm happy to report that from this, there were no material findings left unaddressed. We did submit a few preliminary reports that had various different observations or recommendations, no what I would call material findings that would require us to go and recoup funding or any of that sort. Some of those were just some policy procedural updates that were needed, some non-responsiveness, some folks just failed to respond, and we got back with them. But other than that, I am happy to report that we do not have any material findings left outstanding. And with that, I stand ready for questions.
Any questions for Noah? We appreciate you. You've done a good job. I think if you offered me free money, you didn't need to bar your door. That's what would happen. But I realize this process has not been that easy. We've had to have a lot of conversations, a lot of coaxing, and then in that process, particularly from the federal side, there was a lot of paperwork, and we've had some things for transparency on our state side, but I realize these things were not as easy as I would have originally thought, and y'all have had to put a lot of work into it, and y'all have done a good job, so thank you.
Thank you, Chairman.
All right, well then we will move on to our next item, which is our 911 Program Information Security Assessment Services Procurement Update with Kimber.
Hi, Commissioners. My name is Kimber Snoddy. I'm the contract manager here at CSEC, and I'm here to provide an update on the 911 Program Information Security Assessment. So we had a contract last year that we terminated for convenience at the end of 2023, which left us with a gap in one of our non-key performance measures for LBB. So we've been diligently working to put something in place to fill that gap, and also just for the benefit of the RPCs in general. Through some research, we found that DIR has an entire program dedicated to these assessments. So we found that this is the most beneficial route to go down. There's some cost savings, it's lower risk, and time-wise, we don't have to run an entire procurement. So there's numerous benefits. In order to work with DIR, we have to get all of the RPCs that are interested with an interlocal contract. So the contract will be between the RPC and DIR, and then CSEC will be in the background for billing. We have, as of this report, we have 11 RPCs that have expressed interest, and I've heard that we've got some more trickling in, so I think we'll have a bigger bunch than that. And they are currently in the process of getting those ILCs signed. Once those are completed, we will host a webinar to kind of describe the process for the assessments, and our hope is to hold a webinar in October. And then after that webinar is completed, they'll be able to get started on their assessments through the DIR portal. They can, there's 3 assessments they can pick from. They'll be required to do the Texas Cybersecurity Framework Assessment, and then they can add on penetration testing and vulnerability scanning if they choose. And with that, this is informational only. If you have any questions, I'm here.
Kimber, would you do me a favor and just, so when we had our original contract that wasn't going very well, and then we went this route instead, kind of detail out what's the cost difference that we're seeing?
So we're looking at a cost savings of about $400,000. We've estimated the total, if all 20 RPCs were to participate, it'd be about $2.6 million.
Andrew, I'm going to loop you into this conversation too, because the report here in the packet has the 11, but we actually have more that are participating now. Just kind of denote that.
Yeah, I'm happy to. So we met with, just to kind of get folks up to speed. So I had, TARC had their annual conference last week, and I talked with the EDs and the Emergency Communications Committee through TARC about this initiative, and we've had a massive influx of additional interest over the last couple days. So the numbers in the report itself probably don't accurately reflect the new interest that we have. But from my understanding, I think we're almost at all 20 minus just a handful, but 4. We're actually just missing 4. But the plan is to get everybody through the assessment and work with those 4 that have not expressed interest yet, but to get them kind of on board and or see what other type of needs they have related to getting their InfoSec assessment completed.
Okay. Well, one of the things into the commission, this was a voluntary type program, inviting people to participate. But given what we've seen at CapCog and some of the other incidents that have occurred over the last several years in cybersecurity, I'd like to direct staff as part of this to really go to those remaining 4. Now, one of those 4, I think, has done an assessment maybe themselves, but at least those other 3 to really push them to do this. I think it's important, and it needs to happen. When we've seen some of those incidents that have occurred, I just, from a state standpoint, all the questions that you've got on this and the legislative front, we really need, I don't want to say put the screws to them, but kind of a little bit. I mean, they need to do something. And so this is an informational item. It's not an action item, Patrick, but just as a sense of the commission, I wanted to see where the other commissioners were at on that. Okay. Well, again, we'll ask staff, not that you don't have enough to do already, but to really reach out to those remaining 3 and tell them that the commission would like to see them participate as well. I think this is a good program with DIR, and we really appreciate y'all. Y'all been great on this. All right. Kimber, thank you very much. All right, well, we'll move on to our next item, which is under our 911 service program, and Heather is going to talk to us about Emergency Communications Advisory Committee's annual evaluation of cost and effectiveness.
Good morning, Commissioners. For the record, my name is Heather Barnes, Director of Programs. If you will turn to page 61. Commission Rule 252.8 requires that the Commission annually evaluate the Emergency Communications Advisory Committee, or ECAC, for their work, usefulness, and cost. The annual report is attached to the staff report and reflects that ECAC met 11 times in 2024, or FY24, excuse me. All meetings were held virtually. Total cost estimates were $3,777.51, and all ECAC members met attendance requirements. ECAC continues to assist the Commission in coordinating the development and implementation of NG911 across the state. Key activities for FY25 include continuing the coordination of the federal NG911 grant program, interoperability and interconnectivity, cybersecurity. If possible, plan and host an annual face-to-face ECAC meeting for all 911 entities across the state. Otherwise, we will try to do that virtually. Prepare and submit for consideration a presentation for the upcoming Texas Public Safety Conferences, and support the CSEC Executive Director in responding to requests for information and other inquiries related to statewide 911. Commission staff recommends that the Commission accept this annual evaluation of its Emergency Communications Advisory Committee. I'm happy to answer any questions.
Any questions? If not, then we would entertain a motion.
Yep. Muscat, motion to accept.
There's a motion. Is there a second?
Grove seconds.
There's a motion and a second. Any further discussion? All those in favor say aye.
Aye.
Any opposed say no. The ayes have it. Thank you. All right, Patrick, you're up. Rulemaking. You're bringing back Rule 255.4 in our annual review.
Good morning, Commissioners. Patrick Tyler, your General Counsel. If you would, please turn to page 68, and we will address Rule 255.4. This is a required rule for the Commission to adopt by Section 771.063. The definition of local exchange access line and equivalent local exchange access line, that's a mouthful, is used by all 911 entities. So this rule applies throughout the state, not just in the state RPC program. At our July 31st open meeting, the Commission voted to initiate the annual review. Staff did not propose any amendments to that rule. The last changes we made were in 2005 to account for voice over IP. To date, we received no comments, and therefore I recommend that the Commission conclude its annual review without amendment by approving the company notice for publication in the Texas Register, and that notice is on page 69. Happy to answer any questions.
Any questions for Patrick? Boy, howdy. If you're really going to retire, do you not want to just tinker with it a little bit once? I mean, just for grins and giggles on the way out?
Hey, we'll
Last
bring a chapter
hurrah?
review.
All right. Well, in that case, we would entertain a motion to publish the section that is noted in your packet.
Mitchell move approval.
There's a motion. Is there a second?
Washington second.
There's a motion and a second. All those in favor say aye.
Aye.
Any opposed say no. The ayes have it.
Thank you, Commissioners.
Thank you, Patrick. All right, we're going to move on to poison control, and we have James with a report on the Poison Control Coordinating Committee annual evaluation of cost and effectiveness.
Good morning, Commissioners. For the record, my name is James Johnson, and I will be presenting the Poison Control Coordinating Committee, or PC Cube, annual evaluation of cost and effectiveness for fiscal year FY24. Commission Rule 254.2 requires the Commission to annually evaluate the PC Cube's work, usefulness, and cost related to the committee, including the cost of Commission staff time spent supporting the committee. Accompanying the staff report is the 2024 annual review of the PC Cube. This annual review is a summary of the monthly meetings, key quarterly activities. In FY24, the committee met 12 times, and it has shown that they are useful to the Commission by coordinating the medical and administrative activities of the poison centers, as well as advising the Commission on the requirements of Chapter 777 of the Health and Safety Code. The PC Cube continues to foster collaboration, collective decision-making, and assurances that the requirements of the National America's Poison Center are met. The committee provides expert advice to CSEC staff regarding poison center operations, promote poison center services, all to maximize its efficiency. Commission staff recommends that the Commission accept this annual evaluation of the PC Cube, and subject to any questions that you may have.
Any questions for James? If not, we would entertain a motion to approve the report.
Grove moves approval.
There's a motion. Is there a second? There's a motion and a second. Any further discussion? There being none, all those in favor say aye.
Aye.
Any opposed say no. The ayes have it. James, thank you.
Thank you.
All right, our last item is our Poison Control Coordinating Committee presentation. Dr. Shawhart.
All right, thank you. I'm Jeannie Shahar. I'm co-chair of the Poison Center Coordinating Committee for the Texas Poison Center Network. And today we just wanted to tell you a little bit about our federal funding. It's our other piece of funding that the Poison Center Network uses and relies on quite a bit. So we wanted to just give you an overview. And I apologize if formatting didn't carry over to the notebook very well. There are a couple little holes, but I'll fill those in. The 6 centers of Poison Centers of Texas are funded by 2 primary sources. Our CSEC state funding, which is the lion's share of our funding. And as y'all know, those are legislatively appropriated funds that are then allocated by the CSEC. And then we have our Federal Department of Health and Human Services, Health Resources and Services Administration, Poison Control Centers program. And this is administered as a grant. It's a 5-year grant cycle. And that cycle has just begun on September 1st this year for our new grant cycle. Other funding, and perhaps I should not have included this because it's actually research dollars, so it's not actually funding that's devoted to operations of the centers, but it certainly helps us out. 4 of our 6 centers participate in a research program with Rocky Mountain Poison and Drug Information Center, and that's a research program for researched abuse, diversion, and addiction-related surveillance system. So basically, we redact our charts where we've had exposures to drugs of abuse, prescription drugs of abuse. That information is shared with Rocky Mountain and then is typically sold to the drug companies or bodies that are requesting the information. And then lastly, in-kind contributions of host institutions, which I'm going to cover a little bit. The HRSA program funds poison centers serving all the states, Puerto Rico, DC, Guam, the Federated States of Micronesia, and American Samoa. There are 55 poison centers that are part of America's Poison Centers. And their primary purpose was to establish and maintain a single national toll-free number. So they established the 1-800-222-122 number, and CSEC often has to connect with them when there are problems with that number and call routing, and creates quite a headache at times. I think Jim would agree. They also implement a nationwide media campaign to educate the public and healthcare providers about poison services. And the objectives for our HRSA funding are to support poison prevention activities, to provide high-quality guidance and information to callers to the 1-800 number, provide treatment recommendations, collect data, and then to use that data to inform public health and emergency preparedness responses. I do have a note at the bottom of this one. There's a link that you can go to where you can find really much more complete information. The objectives to be accomplished with this funding are to maintain the number of calls received by the Poison Helpline so they don't our calls falling. Also maintain the percentage of human exposure poison case calls from healthcare facilities and practitioners. We have a real issue with the public seeking Dr. Google's help and often not calling. So we're really working hard to encourage them to call and obtain good quality information. Number 3 is to increase the percentage of human exposure cases with a completed follow-up contact. So when someone calls, we provide information. We perhaps recommend they go to the hospital. Then we call the hospital. We provide recommendations to the physicians, the nurses on the team. We do follow-up calls, and we follow those cases until a patient is discharged. With home callers, we also often do follow-up calls, so particularly to alleviate any anxiety they have. You know, the kid just drank a mouthful of bleach or got into the dishwasher detergent. Parents are often freaked out when they call because they feel like they've poisoned their child. And so we call back usually in an hour to see how the child's doing and just make sure they're okay and let them know they can call us back at any time. Objective 4 is to increase national data on poisonings available in the National Poison Data System. All our cases are uploaded to the system every 7 minutes, and that's used for toxic exposure surveillance purposes. There are some restrictions to our federal funding. First, those funds are only available to centers that are accredited by America's Poison Centers. And I think missing from your notebook is bullet 2. There's a maintenance of effort requirement. So HRSA requires that we agree to maintain non-federal funding. So for us, that's our CSEC funding. If our CSEC funding were to be reduced, or our state funding, I'm sorry, if it were to be reduced for any reason, then HRSA would possibly reduce their funding proportionally. Also, HRSA kindly caps the indirects from HRSA funds at 10%. So that helps us as well. Relative funding for the poison network, there's a couple little pie charts here. So the one on the left, TPCM funding by source. On this one, I excluded the in-kind funding by our host institutions. So you'll see the big blue piece of the pie is our state CSEC funding. And you can kind of see visually what portion is provided by federal funding. And then the radars, which actually after talking to the other centers, were probably closer to 50,000 radars than 100,000. The state provides about 11.4 million to the centers, and that excludes CSEC operations, telecommunications, et cetera. And then HRSA provides about 1.9. For our host institutions, it's difficult to quantify their in-kind donations. These are primarily travel services, human resources, payroll, our physical space. Those are considered in-kind or indirects. The currently accepted federally negotiated indirect cost rate for a public service program is 26%. Our state funding, I don't believe any of our centers are paying indirects to our host institutions, which is why we're calling this in-kind. That 26% would come to almost $2.9 million. And so if that were to become a requirement from our hosts, and it was kept at the 26% level, that would reduce our net state funding from 11.4 to 8.5 million, which would obviously hurt our program. If in the future we do begin including indirects, I think perhaps we could follow the HRSA model and get those capped at 10% to reduce the impact that would have on our programs. And then the next slide is HRSA funding is the poison center regions by population. So you can kind of see how the 6 centers are funded. These are, again, CSEC has a formula for allocating our state funding. There's a base amount provided for administration, and then the rest of the funds are divided based on population, which is similar to what HRSA does. So you can see about 31% goes to the North Texas Poison Center in Dallas, and that's followed by about 28% to Galveston, then 18% San Antonio, then Temple, then El Paso, and then Amarillo. So in summary, excluding the in-kind host contributions, CSEC or state funding provides Texas Poison Centers about 85% of our funding, with HRSA federal funding at 14%. We talked about indirects already. And just a quick update where we are with federal funding. The House, I believe, has recommended a $1 million increase in federal funding for the poison program nationwide. The Senate has recommended a $2 million increase. So we're waiting for them to come together and decide on an amount and hopefully get that authorized. Just to give you a little bit of a picture, our Texas Panhandle Poison Center receives about a little over $1 million in state funding, and we get $92,000 from HRSA. So if we get a slight increase, we could perhaps get up to $100,000 in federal funding. HRSA really helps us with our education efforts because historically our state funding has almost exclusively gone to personnel costs. So it really helps us to enhance our programs, provide more education to our areas. All right. What questions do y'all have?
Any questions for Jeannie?
Thank you. Thank you. I always learn something every time you present. So thank you very much.
Thank you.
How long has the TPCN been receiving HRSA funding? Do you have any idea?
It started right when I started. So I want to say
20 years.
2001, 2002. Okay. And there was a time that HRSA provided incentive grants as well that we could apply for. That's how we started the medication cleanout program. But when we had that big recession in 2010, they discontinued those and they have not re-implemented. But they've been great partners. They're always interested in what they can do to help our program grow, how they can make the program administration run easier. They've been great. It's been a good collaboration.
Well, it's glad to hear that they're considering an increase in your potential funding. And I'm assuming since we're already in the grant cycle, they would allow that increase to happen in the grant cycle. I'm assuming. I would hope that you would be advocating for that. But, in today's climate, everybody's looking to cut budgets. And so that's why I'm just making sure that we're, staying on top of that. Anything that we can do to help the legislative committee can help with those activities, we'd be glad to.
Thank you. Jim and Andrew have been phenomenal. When each center seeks reaccreditation, we rely very heavily on CSEC. We need letters of designation for our service regions. That's always provided, as quickly as they can get it to us. Information on how our telecommunication systems and call routing runs, that's all done phenomenally. Also, one thing HRSA, I believe the Senate is proposing for the increase in funds is to help address all the geo-routing issues that are occurring. So we see a lot of the same issues that 911 saw in the past, and they're going to hopefully start moving us in the right direction to get those fixed.
Perfect.
All right, thank you.
Jeannie, I do have a question.
Yes.
So we were talking about radars there.
Mm-hmm.
What do y'all get out of that? I mean, I know you're providing them this data that they're then selling, and there's not much for you in this from a budgetary standpoint. Do y'all get access to that data, or, I mean?
They offer us to be included on some of their manuscripts and their publications that are on there. Our center gets about $12,000 a year from radars. So it helps fund a little bit of our positions for the time that's required to go through and redact the charts and get those processed and encrypted and sent to Rocky Mountain. It's kind of an academic pursuit, scholarship, to help advance research and really help to make sure that as a whole we're learning more about prescription abuse and diversion, what we can do to help reduce that. Over the years I've been here, we had the big opioid epidemic from prescription medications. There were a lot of changes, and now that's shifted to more the illicit area. But I think radars has definitely helped in identifying some of those issues and getting some initiatives implemented to help address that.
Well, and I wasn't trying to be negative about it. It just, I imagine going through those cases, finding what's applicable, redacting, all that process is pretty time consuming and intensive for y'all. So.
It's actually, it does not require a whole lot of work, which is great. Our electronic health record system does a lot of the search. It does them automatically. They're automated. It goes through and does some basic redacting. We just have to visually go through and make sure it hasn't missed anything. So it does not require it for us, and we're a very small center. It might require half an hour a week.
Okay.
So very little time requirement for the return.
Okay.
Thank you.
Any other questions for Jeannie? All right. Well, we appreciate you.
Thank you. Just want to say thank you to you all for your support over the years. And emergency services can be a thankless area to be in. Nobody really says anything unless something goes wrong. And so we all appreciate your work to support the services. And I know as I'm leaving, everything's in good hands, and we have a good group of directors. CSEC has a good group of people in place. And just want to thank you all and just encourage you to continue the great work y'all are doing. Thank you.
Thank you. All right, members, that brings us to the end of our agenda, unless anybody has anything else. That being said, I would entertain a motion from someone to adjourn today in memory of our departed Commissioner Sue Brannon.
And I'll second that.
All right, there's a motion and a second. All those in favor say aye.
Aye.
Any opposed, say no. The ayes have it. We are adjourned.